So let's dive right into just some specifics about home care, because again, I don't think people, again, really, when they, as you know, um, often what happens is they don't think about home care until they're in the middle of it, like, oh, it's here. I need to think about it, even for oneself. So let's talk about the different kinds of home care that people can get, and some of the different kinds of care they need in terms of custodial care, health care aides versus custodial, and the sorts of things that they need and don't think about figuring that out. Hello, everyone. This is Ron Rowell. I'm the host of 45 Forward, where my mission is to help you make the second half of life even better than the first. Now, if you ask anyone as they approach 50, where would they like to live as they get older? 80% of people will usually say they want to age in place. But the truth is, many families don't really understand what takes to do this, what's possible to do, and they often don't even know where to start. So, what do they need to know before they hire a home care agency or an aide? What questions they need to ask? How can we be sure that they'll get the right kind of care for their loved ones? Today, you'll learn the answers to these questions and much more when we talk with Zubin Kapadia, the CEO of Right at Home North Shore on Long Island. Zubin not only runs a leading home care agency, but he offers a unique perspective from his many experiences in the healthcare industry. And today, he's going to bring his experiences into your home. So now let's meet our guest, Zubin Kapadia. Zubin, welcome to the show.
Thank you, Ron. It's a pleasure to be here. Thank you for having me.
It's a pleasure to have you. Um, so I wanted to start off by just mentioning people that we are going to. I'm going to ask you about your background because you bring it, lots of experience from the healthcare industry, from lots of different ventures over the years. And before we sort of dive into a lot of the nuts and bolts of home care, which I think many people might think they know about, but really don't. There's a lot they don't know, and unfortunately, there's a lot they don't know what they don't know. That's what often happens. But just talk a little bit about what your passion is. What brought you to home care? From your whole variety of experiences. What compels you about being in the business and running a business?
Sure, sure. So I about 31 years ago I graduated as a lawyer, and the first 15 years of my career I spent doing legal work and financial work. And the last 15, 16, I've been in healthcare. I first got involved in healthcare with Johns Hopkins Medicine International, where I was the managing director for their international portfolio in the Middle East. And from there, I went to several other academic medical centers in similar roles. And that was a very macro view of healthcare, almost sort of the cross section between public health and healthcare implementation. So we did large management contracts, we did licensing agreements, we built centers of excellence in countries like the Middle East. I also worked extensively in China and Southeast Asia. But then in 2020, I decided to acquire this company, Right at Home, in large part because in the work that I did previous to home care, I was really looking at healthcare from a macro perspective, comparing U.S. systems to international systems, and I was able to see some of the gaps that we have in our country. And one of the big gaps is taking care of our seniors. It's a real issue because one, we have a growing number of seniors, right? We have probably about 10 or 11% of our population today is above the age of 65, and a growing number of older seniors, so above 75, above 85, more 100-year-olds than we've ever had. Secondly, there's a disproportionate amount of spending that seniors account for in healthcare, and most people know the statistics, or roughly. So, for example, 75 years and older account, or about 7% of the population, but they account for roughly 20 to 25% of healthcare spend. And most of that is curative. So we don't do a great job in this country of preventative medicine or wellness. And so home care, I was passionate about that because I felt like that is an opportunity to fill a significant gap in our healthcare system and also to provide support for seniors as they age and help them age well.
Right. It's absolutely essential. I think that your point that a lot of it's curative, as opposed to preventative. I think in some cases, well, people think that preventative doesn't make enough money, but in fact, it saves a lot of money and it saves a lot emotionally for people who want to do that. So let's dive right into just some specifics about home care, because again, I don't think people, again, really, when they, as you know, um, often what happens is they don't think about home care until they're in the middle of it, like, oh, it's here. I need to think about it, even for oneself. So let's talk about the different kinds of home care that people can get, and some of the different kinds of care they need in terms of custodial care, health care aides versus custodial, you know, and the sorts of things that they need, and don't think about figuring that out.
Sure, sure. So home care usually becomes part of the conversation around 80 to 85 years of age. Now, it differs, right? Everybody's different. Some people may have a disease that impacts them or an injury that impacts them earlier, and some people will not need assistance till slightly later, but on average in that time range, 80 to 85. Most people encounter home care after a hospital visit because their loved one goes into the hospital and they're about to come home and the discharge nurse says, well, you're going to need some additional support before you go home. So either they go to a rehab center and then go home, or they go home from the hospital but with some care in place. And that first level of care is usually skilled nursing. And that is the Medicare covered portion of home care. So Medicare will pay for up to 100 days of skilled nursing care post acute. So typically that's a nurse, OT, PT, or any combination of the above that comes into the home for potentially a day a week, 2 days a week, 3 days a week, and it's very episodic. So they're coming in for half an hour, 45 minutes. They're doing something like a nurse might be changing a bandage or doing some infusion at home or administering medication. An OT or PT would be helping the elder, the senior person, get strength, regain some strength and learn how to function in the home again. But again, that's limited, and Medicare will pay for up to 100, but most commonly it's about a month episodic visits. So that's the first encounter with home care that most people have. Now, the second encounter or the subsequent encounter is the question that is raised when family gets together and says, "Well, mom and dad need more care." This sort of short period of post-acute care that they got is not enough. They need day-to-day non-clinical support, and that is, in the truest sense, long-term home care. And that's what we do at Right at Home. We have a skilled license, so we can send nurses into the home, but today we're only focusing on the non-custodial care. So that is the non-skilled custodial care that you would get in the home for anywhere from, let's say, 5 or 6 hours a day to 24/7. And that covers things like getting up in the morning, getting dressed, brushing your teeth, toileting, bathing, assistance with meals. It can be companionship, spending time with your loved one. It can be taking them to the doctor's office, taking them out for walks. And so most families don't plan for this because the hope is that the loved one will be able to function in the home as long as they possibly can independently. And often the decision is made in the hospital or right after they are out of the hospital when they start to learn about the skilled nursing care that Medicare covers, and then the sort of traditional home care that is not covered by Medicare. So yeah, it's unfortunately not something that we talk a lot about in our society. There are very few guidebooks on it. You know, you can read up on it. You can go to the internet and find out a lot of information, but people don't really get that information until they need it. And so it often creates a moment of panic. So we get a lot of calls like that, like, okay, mom, dad, you know, mom's coming out of the hospital or dad's coming out of the hospital. I don't know what to do. Is this covered by Medicare? How much, you know, does it cost? What type of care do you provide versus what the nurses provide, and so on and so forth. So it is a conversation that we have almost every day with our clients.
Yeah, and usually it's sort of like, well, it's a conversation you'd have had before you came to us in terms of what looking at what you need. And I think that the part of it, as you well know, is the way our society is set up and the expectations. And often the expectation is, well, my daughter will take care of us. She'll come in and help, you know, and or my son or my spouse will take care of the other spouse. And I think many cases start that way until they realize this is not going to work. It's not enough. Well, you know, there are too many demands, or there are things that I'm not really equipped to do. So I think that's part of the issue is that people feel a guilt that they can't handle it themselves. Number one, I don't think it's always. It's sometimes it's the cost, but I think it's from the family's perspective, the expectation of the adult children, um, and also I think that there are concerns over privacy. Right, like, oh, I don't want someone coming into my house. You know, that's my house. Who is this person? You know, and there are isolated cases of abuse that we're aware of, but that's where your training comes in and your vetting of your care. So what questions do you want the family and the care recipient to ask you?
Yes. So those are really good points you made, Ron, is that let me just start with sort of segueing from what you just said. I think it's critical what you just said that it is really important to understand that while you may be able to provide some support as a family member, the stress that builds both on the individual as well as the family unit is tremendous over time. Now, you know, as I said earlier, if they're relatively young in their 70s and they just need to be driven around somewhere once in a while or taken out on the weekends, that's not what I'm talking about. But when the care needs get more extensive, either your loved one is bedbound or they can't walk anymore or they can't use the toilet, um, it starts to become an enormous strain. And yes, it is expensive to hire someone, but what we always talk about is the opportunity cost. So, the individual who's taking care of their loved one often has to leave their job. Sometimes it's in the middle of the afternoon to attend to an emergency. Sometimes it's causing strain on their career. And so, what we find that it's not really the cost because families will figure out sometimes they pool their money together and it becomes affordable. It's really what you said, Ron. It's the burden on the individual family members, and particularly if it's one of the spouses. If a spouse, an 80-year-old spouse, is taking care of an 83-year-old spouse, partner or spouse, that strain becomes tremendous and it often leads to the healthy spouse becoming sick faster. So, yeah, so very good points, Ron. So to get to your last question there, so a few things that we look at and we talk to families about. One is you always want to ask, is the agency licensed, bonded, and insured? Again, very few incidents out there, but you know, even aside from any sort of criminal incidents, someone can get hurt, right? Someone can slip and fall, the aide could get hurt, or your loved one could get hurt. And so those are critical questions to find out from the beginning. Licensure in New York is very strict. It's very difficult for an agency to get licensed. It takes years, very rigorous examination of your operations. The State Department of Health comes in and audits us on a regular basis. So the licensed agencies are really measured at a different level. The second question I would really ask is how do you recruit, screen, and train your caregivers? It's really important because caregivers, like in any profession, can be good, they can be average, they can be excellent, they can be or not, right? So any of the above. So I think you really need to understand what that agency's policies are, what their procedures are. Are they vetting the aides in the beginning? Are they providing the continuing education? Are they supervising them? Do they have a director of nursing who's overseeing them? Are they making regular spot visits without calls? Like calling in advance. All of these things help, in addition to feedback from the family, help the agency, ensure that they have a high quality of service. I would also ask about the agency's availability and emergency procedures. So, a lot of times things can happen, especially if you're getting care in the middle of the night, something can happen in the middle of the night. Does the agency have an on-call representative who can pick up the phone and address the issue right away? Does the agency have a nurse that can come out if there's an emergency? Does the agency have every point of contact with the family so that if one family member is not available, they can contact another one? Do they have connections with urgent care that can come to the home? So these are really important things for seniors to know. And then finally, how does the agency handle a change in condition? So one of the most frequent things to happen with our clients is that they come in with one condition, and over time, you see signs of deterioration. It could be something very simple like they no longer remember where the front door is. Um, our aides are the front line, and so they see that oftentimes even more than the family, especially if the family members don't live with their loved ones. So the aides can spot that. They can identify those issues. It could be, again, it could be a cognitive issue. It could be a physical issue. They can no longer bend over. They can no longer open a closed door. So what's going on there? Is it some acute medical condition like potentially a stroke or something that just happened, or is it sort of a slow deterioration of a physical or cognitive function over time? So those are some of the things you want to vet at the beginning.
Yeah. Just switching over a little bit to the family itself in terms of what you need to know from them and what they need to prepare for, because I think sometimes they're not prepared. And I think that certainly, you need to know, as you mentioned before, some of the needs are physical needs. I guess they're called activities of daily living, ADLs. So it's the toileting, the mobility issues, getting dressed, eating, and so forth. So, what do you need to know from the family? What do they need to think about before they even come to you and say, well, and figure out what do they need, in terms of the level of care? And as you said, that they often don't think about the progression, that they may need more. Um, and well, let's start with that. And then I also want to talk about the relationship of the family caregiving to the direct caregiver professional, because um, sometimes I think families have difficulty, letting go and, understanding the boundaries of what they're supposed to do and not do. So talk about, what do you need in terms of feedback from the family when they come to hire you?
Sure. So the first thing is we want to make sure that the family has spoken to the client, the end user, their loved one. It is critical because you have to realize that that individual has lived 80 or 85 years and they have opinions, very strong ones, often hard to change opinions. Many are resistant at the outset. Many are very independent or have been very independent their whole lives and are reluctant to accept help. And so that conversation needs to start early. Plan on having that conversation maybe a year, or if you can, or at least 6 months in advance of trying to hire someone, because then it'll start to percolate in that individual's mind, like, okay, maybe I do need a little bit of help. And they're very proud, right? So they might say, well, I can get dressed or I can take a shower on my own. But you, as the child, know that, yeah, you probably can, but you can also slip and fall in the shower, hit your head, and all sorts of things can happen. So that's when the worries start creeping in. So have that conversation early, prepare, get the house ready. There's some very simple things that you can do as your loved one is aging. removing sort of carpets and mats that slide, of course, lowering lips. So there, if there's a step up into a tub, maybe, or a shower, flatten that. Making sure there are rails in the bathroom for both the shower as well as toilet, lighting in the house, and so on and so forth. There are companies that actually specialize in this, but getting the house ready is critical. And then talking to us as far as understanding what it is that you want for your loved one. So you gave some good examples, Ron, and it's a nice segue to the next question that you had, which is how does the family caregiving interact with the agency caregiving? So think about that. So let's say you have two or three family members, siblings who come over once in a while. They might come over at night during dinner time, or they may come over on the weekend. So how do you build the caregiving around that? Because you still want to maintain some role. And so you might say, yeah, I will come over at night, make sure mom is fed, and then make sure that she gets to bed okay. But then I want the aide in the morning hours or the afternoon hours to do some activities, or go out to doctor's office visits, or go to the park, or whatever. So I think it's having that conversation with the family members, and then letting us know, because at the end of the day, we create customized care plans. As you said, this is really about the activities of daily living. It's not about clinical care. This is about staying healthy and well in the home, as well as enjoying each day as much as their physical and cognitive abilities allow them to. So that care plan that we develop will include, okay, medication reminders, toileting, bathing, and all of those things. But then what is it that you think your mom would love to do on Monday, on Tuesday, on Wednesday with the aide? And let's design a plan around that, because this is what long-term home care is. And so I think as long as we have those conversations in advance, we're setting ourselves up for a successful experience together.
So I'm just gonna so to review. So first, have a conversation with your loved one. Make sure that they're aware of what you're trying to do, and get out the emotions, some of the opinions about, and the anxieties about it. That this is going to happen. Second, preparing the house. That's a great point. And then third, having the conversation with the agency about what is the plan of care, and what's, and and it so there are family dynamics to begin with, and then there are the interdynamics between the professional care and the family care, and that's so they're juggling a lot of things and mixing a lot of things, and I think um, and families, then there's the what I call, and I have a caregiving navigator guide that I know you're aware of, where I try to map out some of these checklists. But then there's the what I call the sibling syndrome, where you have several family caregivers involved. So you're sort of negotiating with them and making sure that now does it usually you usually say like, listen, okay, there's several of you. Who's the spokesperson for your mom, or and and also making sure that that person, again, recognizing the client still is your loved one. It's not you. And I think this is another thing that family caregivers, sometimes try to take charge, and like, I know better now, I'm the parent, and it's just like, yeah, but this is an adult, it's not a child. So maintaining that dignity for the cared one is something I think that you probably come in contact with, implicitly. But how do you work with your caregivers to basically be aware of these dynamics and navigate them?
Yeah, it's sometimes tricky, and sometimes the family has figured it out in the beginning. So, as far as understanding who's playing what role, we leave that to the family, and often they'll tell us. They'll say, "Okay, Joe is going to handle the finances for Dad, so you send the bills to Joe, and Susan is going to do the healthcare, manage the healthcare issues." And the home care issues, so you can talk to her about schedules and doctor's appointments and so forth. So we definitely rely heavily on the family. We work very, very closely, and sometimes they all want to be in the loop. So we'll send emails to everybody. We'll send the care plan to everybody. But often, yes, we do want one point of contact for emergencies, for understanding, the shifts and making sure the schedule is what they want it to be. But I think, again, that dignity point can't be underestimated because oftentimes what we do as children is that we will dictate to our parents when they reach a certain age, almost the role reversal, right? As they were dictating to us, we start to say, "No, mom, you have to eat this. No, mom, you have to go here. You have to do that." And most seniors will comply. And that's just the circle of life. But it's important to step back once in a while and say, I know that I am now the parent of my parent in some ways. However, they are still very proud of who they are. They still want dignity. They still want agency. So it's sort of a balance and being able to say, okay, mom, what would you like this care plan to look like? And to the extent she has the ability, obviously, if she has dementia and can't really formulate those thoughts, that's okay. But to the extent she has the ability, let her play a role. And I think the more that the children of the clients do that, the smoother it is long term.
Yeah, I agree. I think that providing that sense of dignity and a sense of agency whenever possible, I think is, involving them in the decision making about what they want to do and how to go forward, I think is critical. Um, now, one of the issues is that it's continued social engagement when they're home. So that's one thing that I don't think people think about too. So is that something that you talk to the families about? I mean, and I think certainly the 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 direct caregiver, the aide, can provide some of that social engagement. And I think that, especially under long-term circumstances, I think that the family, I think they appreciate it, but don't realize, that the caregiver, the professional caregiver, and the care recipient often have very strong relationships in addition to the family, and so they really care about them, and so. Do they get involved in social activities? Is it where that the discretion of the family? They decide, like, look, I want you to come with us on this, activity. How does that work out with the agency in terms of what they're allowed to do?
So we're very flexible when it comes to what the caregiver is involved in. Naturally, if the caregiver is asked to go to a family function, we'd want to know in advance where is the function, what time, and most times, for instance, if it's a wedding and they want the caregiver to go to the wedding to assist with mom and dad, that's completely within the bounds of what we do. If they want to travel overseas or out of state, of course, that requires special approval. We want to make sure that our insurance covers it and so forth. But on the day to day, so you've got day centers, where there are a lot of senior day centers where seniors can go and do activities for several hours, have some food, come back home. You have specialty centers like Alzheimer's and dementia care centers, which are wonderful for those with the disease because they have specific activities that engage the senior. Those are highly encouraged. In fact, we work very closely with the family to help identify those activities or those centers. Another one, YMCA's, of course, and then there's a Jewish community center, and there's several in our area, in the New York City metro area. So a lot of our clients will go to those centers, and we encourage them to because, again, it's about there's the mental, the sort of cognitive mental side, and then there's the physical side. And to the extent, as I said earlier, that you're able to do certain things. So if the senior is able to ride a stationary bike or potentially swim or do those things, great. If they can't, maybe they sit and watch certain activities. Maybe they're focusing on their cognitive abilities. So it is very important both in terms of maintaining function, as well as you pointed out, Ron, the social aspect of it, because that is something that keeps us alive, right? At the end of the day, having community, having socialization, having people that love us and people that we can love is a big part of who we are. And that doesn't stop at any age, quite frankly. So, again, it's customized. Some people are introverts and they want a quiet time. They'd rather spend maybe, a few hours socializing, but most of the time they want to be quiet. So again, it's definitely customized and we work with the families to identify those opportunities. Very, very important.
I wanted to shift zoom in a little bit to uh, the agency side. Of the so interestingly, there's been a lot of talk, and I've noticed in my field of just providing information about caregiving to caring for the caregiver. Most of the time, though, we talk about the family caregiver and the concern over taking care of yourself. That, as you pointed out, I think there's a lot of stress and emotional strain on the family member and the caregiver. They often have health issues themselves, so there's a lot of focus on the caring for the caregiver in that sense. But what I found interesting about your work is as you look at that part of it, but also caring for the professional caregiver, and how you support them. Because one of the things that has come up is, I've done a lot of work for AARP in New York State, and there's a lot of there is a lot of impetus to shift care to home care, provide more funding for home care on a statewide basis. Um, but there's not really one of the issues as well, the shortage of professional caregivers. Like, well, because the pay is low, there's a lot of stress. It's not a high level job, but you've done quite a bit to really address these issues. So talk about that.
Sure, sure. So, I mean, at a higher level, you're absolutely right. It's not a glamorous job, right? Um, it's a hard job. You're taking care of someone at the end stage. You're doing the things that are difficult, helping them toilet and bathe, and it's stressful. You watch many of your clients pass away. So this can eat at people, and so I find that the people who come to our profession and stay in the profession are those who are most passionate about it. They almost see it as a calling. In fact, many aides have said to me, "I don't do this for the money. It's a calling." And so I really that's a big part of why I do what I do and why I love it so much. So one of the things that I did when I bought the agency, it was about 6 months after I acquired the agency, is I set up a support structure for them called the Caregivers Advancement Fund. So it's a nonprofit fund that has two components. One is it has an allocation for educational advancement, and the other is an allocation for emergencies. So we provide grants, small grants, typically between $500 to $1,000 in both categories. And so for education, we've done things like helped caregivers get certificates, HHAs, home health aid certificates, or personal care aid certificates. We've helped them take additional college courses. I had an aide who wanted to become a teacher, so we funded part of her semester to do that. And so we don't discriminate on the topic or the specific curriculum. The focus is really how can we help you advance your career, whether that's in caregiving or outside of caregiving. And on the emergency side, it's things that for us might be relatively easy to manage, but for a caregiver, a $500 car bill or a flood in the basement that cost them $1,000 to repair might set them back for weeks or months and often impacts their career. So they may have, husband and wife working, maybe they have a father, mother in the home, and they have kids. And all of a sudden, this one small emergency is causing them to really spiral backwards. And so the idea is that, and where I got the idea is that in a lot of the hospitals and large companies that I worked for, there were these types of benefits or funds um, for the larger population, and large companies are able to do that. Small companies, small businesses, It's very difficult, because you have to set up a 501(c)(3. And so what I did was I work with a community foundation that is a 501(c)(3, and I'm able to park under their 501(c)(3 designation. And so all the administration aspects of it are a lot easier. The IRS rules around what you can distribute are a lot easier when you're a sub fund, and so on and so forth. But the true inspiration for this is kind of is my own story. So I am a first generation immigrant, and my parents came here in the early 70s, and they worked multiple jobs. My father was a medical technician, worked in a hospital, often working two or three jobs, night shifts, day shifts. My mom was an unskilled laborer. She worked as a seamstress at times. She worked in retail. Um, and for us, in the 70s and 80s, I saw the struggle firsthand, myself and my two siblings. So when I got to where I did, and I saw the pool, the workforce that I had, so I acquired this company, and today we have about 160 or 170 staff. Um, and I looked at the workforce. I saw my own parents in them. Um, and many of them are first generation or second generation immigrants. And I said, well, heck, I came full circle after 50 some years of life. And so it was a real eye opener for me and an opportunity for me to give back and say, okay, I know the pain. I know how hard it is for these people. And and their salaries are not great. The good thing is that New York State has been regularly increasing them, and now there's a separate category for home care workers. Their minimum wage is actually higher than the state minimum. So right now it's $19.10 an hour, and it continues to go up, whereas I think the regular minimum wage is around $16 or 16.50. And so they've created this two-tier structure. And what that's done, and it's happened over the last few years, it's brought in more caregivers, higher qualified caregivers. And I think we have to continuously look at that. I am also, among my very many hats that I wear, I'm also the co-chair of the Home Care Association of America's New York chapter. And that's one of the issues that we continue to look at is how do we support the caregiving workforce? Because as you said, Ron, what's really critical as we look at the next 10, 20, 30 years is we have this baby boomer population that is now coming of age. So the first baby boomer turned 75 a few years ago. And so, as I mentioned at the outset, um, you have care needs typically after 80. So now we're entering that phase where many of the baby boomers, when they hit 80 or 85, are going to need a lot of care. And this is the largest segment of our population in the history of America. So there's going to be significant strains on this industry over the next 10, 20, 30 years unless we do more to incentivize caregivers to come to the profession, and then we support them while they're in the profession by giving them educational opportunities and emergency support. So I'm doing my little part, but I think the real thing is advocating for it and trying to do it at a state level in Albany and as well as a federal level because it's a bigger problem.
Yeah, I think that certainly the demand is going to increase. I'm in this baby boomer generation, so I see that in the immediate cards. But I think that just to increase that, it's going to just get larger and larger. So there are what Gen Xers in back of us, and then the millennials after that are an even larger population than baby boomers. So it's just going to be incrementally growing because we're getting older and older. But then, as you point out, with increased longevity, there are going to be more people in their 90s and hundreds getting care, while the others, the lesser olders, in their 80s, are still going to be coming up and needing care. So I think the demand is there. Um, but I really love your commitment to this and vision in terms of supporting the professional caregiver because I think that most people say, well, just pay them more, you know? But it's not just that. And so what I liked about what you said is that I think you've created a culture that's different. And I think probably people sense that when they come into your company. Is that not so?
Indeed, I hope they do, and I talk about culture all the time with my staff. My office staff, we have about 8, 9 people in the office, and then the largest part of my staff is in the field. Culture is the most critical thing to run any successful organization, but I think in this space, having a culture of caring for your workforce, caring for the clients, being responsive is critical, and you can't really run a successful agency without it. We are consistently looking for ways to motivate and incent and train and expand our workforce. And it is a 360-degree approach. It is, are you happy? What works for you in terms of your schedule, in terms of what you want to, accomplish? How can we support you in that? As I said, it's a tough, tough job. You're going day in, day out. So a typical caregiver's existence is wake up, get ready for the day. If they have a morning shift, they're going from their home to the client's home, and then they're going back. And then the next day, it could be the same client or a different client, but it's rinse and repeat. And there's no building, there's no hospital or clinic that you're going to. So there's no rah rah, there's no lunch party or motivational events that are happening as typically you would have in a building. So we try hard, and these are employees of mine. They're not contractors, because in New York State, licensed agency has to employ their aides. So we try hard as an employer to build that culture in sort of a virtual or remote sort of way, through a lot of communication, a lot of recognition events. Last year, so Right at Home has an annual award for Caregiver of the Year, and we were fortunate last year that one of our caregivers was the winner of the Northeast region. And that was a tremendous moment for her and her family. We had them in for photographs and dinner and recognition ceremony. We shared that with the other caregivers. This year, we've nominated another fantastic caregiver, and we're keeping our fingers crossed that he wins the award. But though we are consistently looking for ways to do that, because again, as you said, Ron, culture is critical.
Absolutely. So, in our last chapter of our conversation, Zubin, I just wanted to talk about some of your broader thoughts about how home care fits into our larger ecosystem of care for our elderly, and for special needs populations. I mean, I think that um, I don't think we think about it enough in terms of how much caregiving broadly is part of our society. Certainly, you sort of mentioned, you're growing up, so you recognize your parents raised you. They were caregivers, although we call them parents. um, and that, as you say, you've come full circle. And I think that you've, come full circle too, from the grassroots to the higher, perspective of the mountain, and now you're back to the grassroots. So, how do you think we're doing, overall? And you've looked at, I know you've looked at some, well, I think in one of your previous your global solutions unit, and a few years ago, you developed partnerships with the providers, mostly in China, Southeast Asia, developing new models of care that are culturally sensitive. So, just some of your final thoughts on what you want to do going forward and what you think the needs are in terms of the industry.
Sure. So I think the we're doing okay. I'd say as a nation, we're doing okay. We're not doing nearly enough. It's a global problem, a universal problem. I wouldn't pin any blame on the U.S. in particular, because in my travels, whether it was in China or the Middle East or South Asia or Europe or South America, I saw common issues. One is rising population of seniors across the globe. Two is we're living longer, as you said, Ron, right? So um, if you retire at 65 and you live in the old days, you lived to 75, okay, you didn't have a whole lot to think about. But now if you live to 80, 85, 90, 95, Now you've got a good, 25, 30 years, maybe more. So financially, obviously, that's a big issue. How do you support yourself? But from a care perspective, it's really important to age well. That's really what we all want. And aging is hard. Aging is really, really hard for many people. And sometimes it is tied to socioeconomics, and sometimes it isn't. Even wealthy people sometimes are not aging well. And so I think there is a lot that we can do to focus on wellness, prevention, caring for our seniors in the home, anticipating, because think about just some very basic things. You want to be able to go to the grocery store, lift a grocery bag. You want to be able to lift maybe your grandchildren or your great grandchildren. You want to be able to walk the neighborhood in the park. Just some very basic things. So, how do we do that as we age? What muscles do we need to continue to grow and keep strong? And how do we prevent, to the extent it's possible, cognitive issues, right? I mean, certain cognitive issues are unpreventable today because we just they're genetic and we don't have cures. But to the extent we can keep our brains sharp, how do we do that? So there's a lot that we can do. We're not unique around the world. Um, I think the best systems are those that have concern and knowledge of social determinants of health and have funding for social care. So, what I mean by that is there's a whole science around social determinants of health, like what causes you to be healthy, nurture, nature. So, sometimes it's genetic and sometimes it's your environment. How do we sort of analyze that and say, how do we create environments for seniors that are healthy for them? Walkable streets, uh, you know, easily accessible public transportation, stores, and so forth. Um, and I think creating models of aging in place that are suitable for us as we expand. These are big picture thoughts, and I know it's a lot, but I do think that we need more effort from a policy level as well as from a business level in this area. And I am optimistic. I do think that we have a lot of knowledge in this country. We always have. I think we've been at the forefront of a lot of discovery in health and medicine, and we will continue so long as we can control the cost of it. And I think that's really the biggest challenge, honestly, the rising costs.
This last thought on obviously there's a lot of talk these days about AI technology. Are there ways that we can leverage technology to help us in home care? That I mean, there are certain devices that are you're exploring in terms of basically sort of assistive technology as part of the human component.
Sure. I honestly believe there are. I don't think technology will ever replace humans in this area. I think having an aid, a human being taking care of another human being is a very unique thing. So that I don't think is going to change rapidly, and I'm not concerned about it for my business. But there's a lot of assistive technology. So there are, we've always had fall detection devices. They're getting a lot better. We now have very sophisticated lasers and cameras that can detect falls, in addition to the wearables that do. We have, clothes and bracelets and wear watches and devices like that can measure blood pressure, heart rate, that can predict a fall or can predict or that identifies a change in condition. There are robots in the home now, in some homes that can read the newspaper to a senior or can act as a medication reminder or dispense medication. There's telehealth, of course, that's become huge in the last, 5, 10 years, particularly after COVID. Very, very useful for seniors, particularly those who can't get out of the house and they have some basic issues that can be dealt with. There are now urgent care companies that come to the home, and so instead of, if you have heart palpitations or you have something that is causing you pain, instead of rushing to the ER, or rushing meaning you go there and you wait for 5 hours, you can actually have a doctor come to the home within a couple of hours, saves a lot of money, And obviously, if there's an emergency, they will send you to the hospital, but those are critical functions. And now some states, New York included, have started to implement hospital at home programs. So even for those that are very sick, they can replicate a hospital environment in your home. So, putting the monitors and the television cameras for the nurses to dial in, the hospital bed, the IVs, and so forth. So there's a lot of technology that's entered the home that will facilitate home care and care of seniors in the home. I think that's the frontier. I really think that, um, as I said at the outset, there's stages of aging. You go from your 70s when you need a little bit of support to your late 70s or maybe your early 80s when you need a little bit more to your late 80s and 90s when you need a lot more. And so depending on when you need it and what you need, you can start with technology as a greater proportion of your support in the beginning, and then a human as a greater proportion of your support down the road. So I think it's very I'm very eager to see how this all plays out.
Well, thank you, Zubin, for a terrific conversation. I really appreciate your time and your thoughts and your innovative approach. Now, if people want to get in touch with you and find out more about your work, especially if they want to know about this Caregivers Advancement Fund, which I think is really extraordinary, how do they get in touch with you and find out more about you and your company?
Sure. So I can be reached by phone, email, or you can just go to our website. Our phone is 516-513-1070. Our website is RAH, stands for Right at Home, rahlongisland.com. And we'd love to answer any questions that you have. And even if you're not in, don't need care at this point, or just curious, I love talking about the topic. So feel free to reach out. And thank you, Ron, for your time. I really appreciate it.
It's been a pleasure. So, again, folks, if you want to listen to Zubin, you can, and you'll be able to find him on my website, 45forward.org. And you could go there and find out upcoming shows as well as an archive of my previous shows. If you have comments or questions, you can reach me at ron at 45forward.org. And you can also sign up for the podcast or for my newsletter by going to 45forward.org. It comes out once a month, and I look forward to more engagement with everyone. So until the next episode, folks, keep moving forward, 45 forward.